evidence was marginal but positive, while other studies claimed even homemade masks could reduce transmission. Well, with 10 days to go before the law changes, I asked Cambridge psychologist Dr. Sander van der Linden where he stood.
Well, as a scientist, I follow the evolving evidence, which now seems to be suggesting that there's benefits to wearing masks. So I've personally been wearing masks for the past few months, in fact, because I think it's a low-cost behavior, and I do it to protect other people. Mask wearing is a public behavior. You know, if other people see people wearing masks, they're more likely to adopt that behavior. There's some interesting psychological effects we can talk about. People have raised the concern that, maybe when you tell people to wear a mask, they feel invincible and they won't do other important things like social distancing. Social distancing is still one of the most important behaviors. I've not seen much evidence for that claim, for the fact that, people will stop or either increase their risk-taking by wearing a mask or stop doing other important behaviors. If anything, I think it just sends a signal that there's a deadly virus out there and that we need to be aware of it.
The government has always said that it is following the scientific guidance, but that scientific guidance has, of course, changed. Do you think that equivocation is going to be a problem for people?
Well, I do think the government has been slightly confusing in communicating the scientific evidence around masks and their policy around mask wearing, only in public transport, not in other places. Should you do it in enclosed spaces where the risk of transmission is high or not? So I think, overall, we need to look at a public health communication strategy that includes masks, social distancing, frequent hand washing, and provide people with the best available evidence on those measures. And if the evidence is evolving and the government decides that mask wearing is now important, we have to think about how to encourage people to do that.
Dr. Sander van der Linden there. Next, with no school runs, fewer workers to ferry